Welcome to Living Healthy Chicago. I'm Jane Klaus. We want to kick off today's show by talking about our skin. In recent months, we all started wearing masks. But how do those masks impact our skin health? And are there extra steps we should be adding to our skincare routine? Let's get some tips from a dermatologist about what's important. Joining me is Dr. Eden Lake from Loyola Medicine. Now, Dr. Lake, wearing masks are becoming part of our daily lives. How can wearing masks impact our skin?
We've been seeing a lot more of lower face irritation, lower face acne, something that we've come to call maskne in our community. Under that occlusion, your skin is not breathing. We're having a lot of new perioral dermatitis coming from having to wear a mask all the time.
Can it make a difference if we're wearing a cloth mask versus a surgical mask?
There are a couple things to consider when you're choosing a mask. First of all, cloth masks are great because you can wash them. All of your oils are going to be trapped on the mask, so a surgical mask is better if you're going to be interchanging it, so that's why physicians are going to be wearing surgical masks. Also, surgical masks, we are recommending that those be left more towards medical professionals in case of a second wave.
How often should we be replacing or washing these masks?
It really depends on how often you're using it. For somebody who's wearing it all day, nonstop, you really want to be washing that mask once a day or discarding it daily. But think about it like a t-shirt. It's again just fabric touching your skin that's getting oil on it, it's getting contaminated. You want to be washing it relatively frequently.
If we're wearing makeup and a mask, is that going to impact our skin as well?
The American Academy of Dermatology has actually put out some guidelines as to what to do during this time. And not wearing makeup on the lower face is very important just to decrease that risk of maskne and the problems that we've been seeing with that. So any product that you're going to be wearing on your skin, especially if you're acne prone and especially with masks, you want to look for the words non-comedogenic. That means I do not cause acne. So you really want to focus on only putting on products that have that.
Now, we all know we should be wearing sunscreen, but should we be wearing sunscreen on our faces if most of our face is covered?
If you can see the light through the mask, that means the light can see you. You're never going to be at fault for adding that extra sunscreen. There's really no reason not to, as long as, again, it's non-comedogenic. It really shouldn't be causing any acne or increased skin irritation being under the mask.
When do we just go see the doctor?
For the most part, if you're already struggling with acne, you've probably noticed that the mask is making your acne much worse and that you're going to need to increase your regimen. And then if you're really not acne prone and this is a new thing to you, probably best to go see a doctor.
So I really think at the end of the day, even though our faces are covered, we cannot forget about the skin.
Don't forget about sunscreen. Just look for something that says non-comedogenic. And if you're really having a big problem with your mask, please do reach out to a healthcare professional because sometimes we can make it better so quickly.
Thank you so much. Great information, Dr. Lake. For even more healthy living advice, just head to our website, livinghealthytv.com. Hey, did you like that and you want more Living Healthy content? It's easy. Just check out these videos right here.